Welcome everyone to another podcast to my channel, Dentists. This podcast is going to be with a very special guest, an interesting dentist, started his journey in the US. He's also from Syria. He was with me in the same university, same year. We graduated together. He's been in the US since 2014, similar to my story. We took especially maybe the same path. You will listen and hear his story. We'll know more when we talk. So please be with us. We've got here Dr. Hamza Atasi. And Hamza, please introduce yourself if you don't mind.
Oh man, good to see you, man. It's been a long time. I really miss talking to you and miss, seeing you and everything. My name is Hamza Atasi. I'm an oral surgeon here in the US. As a doctor, do you want to be called Anas ولا
No,
شو؟
we'll keep it informal. Anas
Hamza.
and Hamza is fine. Yeah.
Yeah, okay, yeah. So yeah, with Anas, I was with Anas in the same school, and this is how our journey started. We didn't know that this is gonna happen. Like, this is the funny thing that I remember, when we were in our 19, 20-year-olds in Syria, like we used to cross paths and talk and laugh sometimes and play some sports together and things like
Football and
that. But
cards.
nobody knew that 15 years later or 14 years later, we're gonna actually be sitting here talking with each other, just sharing how similar our paths ended up being.
Exactly.
Yeah, we share so many good friends together, also Amr and Maher, and oh my God, do you know
Yasin,
Bassel?
Mohammad,
Yeah, yeah,
everyone. Time flies, and I still remember the days during our time in first campus in Dara, and then when we moved back to Damascus, and we used to sit together and play cards, even if you remember those
yeah,
days.
yeah,
I
yeah,
still
yeah.
still remember since like we were undergrads. Hamza was always like passionate about oral surgery. I still remember I told him earlier before we started that he was always passionate about oral surgery, and I'm so impressed and amazed about like the way he reached his goal and the dedication he put in towards this. It's not easy path for him, neither for anyone. But like in the US, it sounds from what he said, and like money wise, time wise, the commitment is harder than maybe the UK. And I totally understand this. Like everything, every step he did, it's just like amazing, and the hard work he put on. And he's now trying to build maybe a legacy for a future kids and also for maybe our university and Syrians in the US. So I'm gonna trouble him first to start by just like the journey from Syria. So we graduated in 2014. As I mentioned, he was always passionate about oral surgery. And then how he decided on the US and then his journey on the qualification exams. So tell us more, Hamza.
Time maybe we saw each other was maybe the last day of dental school graduation. Maybe we hung out a couple of times after we saw each other, elsewhere. So graduated in, early 2014. Then, 4 or 5 months later, in May 2014, I traveled, booked a one-way ticket to the US and came, landed in Atlanta, Georgia. I crashed at my sister's place for like 6, 7 months. Then I knew that opportunity is going to be more in Boston. So I went to Boston, crashed at my brother's place for like another 6 to 7 months. Till I was able to find my way and like find a job. So then I found a job right away as a dental assistant in like an area in downtown Boston and just kind of moved out and started kind of renting and things like that. I worked as an assistant for a year. I worked in a multi-specialty practice. So the multi-specialty practice had some people who were general dentists, some people who were endodontists, some people who was oral surgeon. So there was an oral surgeon there. And when I was an assistant, I used to assist this oral surgeon a lot. And I was really influenced by him. I was like influenced by the way he was treating his patients and influenced by the way he was, kind of managing the whole situation and how he was, going about himself. And I was really influenced by that. So I was like, okay, I want to be like this guy. Choosing oral surgery was more like choosing a personality and choosing an influence
Life
and
and
trying to
work
be
style.
I want to be like this person, and this person is an oral surgeon. Maybe this is like a very stupid way to go about your life, but this is how it was. So therefore, I want to be like this guy. So, and he's an oral surgeon. So I like oral surgery. So I want to do this.
Mhm.
So then after working as an assistant for a year, I go to dental school and I do 2 years in dental school to become a dentist in the US, to be able to work in the US as a general dentist. At the same time, I had in mind like, okay, I'm going for oral surgery, and oral surgery is a very difficult thing to, get into, especially as an international in the States. So I was like, I'm gonna have no life. I'm just gonna, study, 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 and do whatever it takes to get accepted into oral surgery. And I did that for 2 years. I had no life, just kind of really, really trying my best to do it. And then ended up working as a general dentist after graduation while applying as an oral surgery residency. Because of my, kind of immigration situation, I was able to apply to only 5 programs out of like the 100, and I got 2 interviews, which is in our terms, very, very limited. Usually, in order to get accepted, in order to almost guarantee acceptance, you need like 6 to 8 interviews to kind of be like, okay, I'm gonna match.
Okay.
So getting, 1 or 2 interviews usually means that there's a high chance that you're not gonna match. So I got 2 interviews, one from Boston University where I was doing my DMD degree, like studies at, and Tufts University, which is another school kind of across the street in Boston, Chinatown. And while working as a dentist, then got matched in Tufts. Actually, I didn't match in the school where I was at. I matched at a different school. And then I did 4 years of oral surgery in Tufts Hospital, Tufts Medical Center. Very difficult, kind of grilling situation for 4 years. Lots of calls, lots of kinds of uh,
Emergencies, entry,
emergency,
non-stay.
lots of kind of events that really shape your behavior. Lots of things
So
that are
I
so tough to the
remember.
point that make you very, very numb to certain things. And then you graduated 2 years ago, and now I've been in private practice for 2 years. Kind of working in, kind of bread and butter oral surgery. We do lots of dental implants and wisdom teeth extractions and biopsies, pathology, things like that.
Amazing. I remember, I'm not sure, a few years ago, I remember that you were doing a specialty training, like oral surgery training, and I used to see your posts or stories on Instagram when you were on shifts and on calls. I thought, like, at the time, Hamza is doing what he likes and what he wants to do as oral surgery. And I used to see you, like, in the scrubs, a night shift
Yeah,
with some colleagues and having coffee, tea across the table, just like trying to pass the night. But that's a
yeah,
tough job. It's not only dentistry, but also to helping people,
yeah,
regardless of what we're doing. I know money is an aspect, but also this, as you said, oral surgery is not only dentistry, is a mixture of dentistry and medicine. I want to go back slightly just to explain. So my audience, your audience, possibly people who are watching and listening to us, want to know, maybe break down slightly of the steps of being a dentist. I'll go back just to, you said, as a dental nurse or dental assistant. When I moved to the UK as well, I worked as a dental nurse in a practice
yeah,
while I was doing my qualification exam. And I
yeah,
worked with the practice specialty also, perio and oral surgery. We used to place implants, do surgical extractions, and that affected also my decisions. I wanted to do oral surgery
yeah,
before, but like I
yeah,
was doing this exactly. This is why when you were telling me the story, I thought I did exactly the same. And when you
yeah,
said that working with someone in a specialty to know what you like, it's not, I don't think it's the wrong decision. And that's what I'd always recommend my, let's say, younger peers, that try to put yourself in a position of this guy in that specialty. Even if not work, try to shadow them maybe for a week, see how their life look like, their work life, what type of patients, what type of treatments they've got. This will influence your decision. Do you want to be in their shoes in the future, or you want to have some other type of specialties? So Hamza here, he did try the general dentist, tried the endo, and tried the oral surgery, but nothing like gives him butterflies apart from the oral surgery, which understandable. I'm the same. I love doing things with blood sutures and things. So for yourself, finding a job as a dental assistant, is there any requirements for the practices to take you as a dental assistant, like degrees, TOEFL things, or you just like apply to jobs on somewhere?
I don't know, honestly. I forgot. But what I remember is because that was like 10 years ago, but usually you don't need TOEFL. You don't need TOEFL for that. you need there's an application that you apply to,
Mhm.
and there's different kinds of dental assistance and licenses, like the ways of you can do it. So there's one where like if you go to dental assisting school, then you become like a certified dental assistant or something like that. So when you do your application, they ask you like, do you want to apply for the certified one, or do you want to apply for a different one? And
Mhm.
then what you do as a person, like us immigrants coming and you didn't go to dental assisting school, if you want to do it the way I did it, then you do on the job dental assistant. That's the one that you have to click on.
Okay.
So once you do on the job means that you're getting your license and you're going to be working as dental assistant, and you're basically getting it on the job.
So you learn the skill, you learn the dental assistant as they consider us. I the same in the UK. There's no
Yeah.
different like qualifications, but when you enroll, like when you get yourself a job as a dental nurse, you'll be as a trainee dental nurse. Dental practice you're working in, they are obliged to have you enrolled in a dental nursing course. So while
Yeah.
you're working, you are like in a dental nursing course. You have to attend like lectures or something once every 2 weeks, and then you've got exams to sit if you want to continue on and become a qualified dental nurse. So that's
Yeah.
like, seems similar to what we've got, but in your terms in the US, on job it's called rather than trainee dental nurse on
On the
job.
job, yeah. So
Assistant.
yeah, you need three things to actually be able to work as a dental assistant in the US. You need three things.
Mhm.
Number one is you need to apply to become a dental assistant, and that you click on the job. You need to do what we call a CPR course, which is like basic life support.
Mhm.
So you take that. This course is 2 days or one day even. Very easy to do. You just book it and you go there. There's like a practical section and a theory section that you pass,
Mhm.
and you get that. And then you need to do what we call a radiology course, the radiology or dental X-ray course certification or something. So that is a day or also another day where you go. There's a theory and there's a practice, like a dental school around your area, no matter which dental school. And you meet some people and they teach you how to take X-rays, how to take PAs or bite-wing X-rays and things like that. And then you get your license, and those three together is what's going to allow you to be to work as a dental assistant. You can actually work as a dental assistant without the radiology course, but you can't take X-rays. So,
Yeah.
like, if you want to go and start, you can go and start just with the application that you do and the CPR thing, and then you can start right away. And then once you start, sometimes even the practice manager or someone in the practice can help you find a radiology course, and they can hook you up. And then you can just learn how to do the course. You take the course, you get your certification, and then you start to take X-rays, and you're done.
Nice. That will maximize maybe the chances of getting jobs if you've got the radiology with the CPR. When you have it ready, the practice
Yeah,
is
if you
maybe
have
looking
it ready, yes.
easier.
Yeah, if you have it ready, yes.
Okay, and the salary, let's put it this way, as a dental assistant, is it enough to live? And
Oh yeah,
on
yeah.
average, how much they get paid, let's say per month?
It depends on what kind of assistant you're talking about. Like if you're doing a dental assistant for general dentistry, that's usually you're talking, depending if you have experience or no. With experience, you would say maybe like 27, $26 an hour. With a lot of experience and significantly good, you may be paying like $30 an hour. No experience, you're talking about 21 or $22 an hour. Yeah.
Unlike,
If you're an oral surgery assistant, then you're more than that. You start at 24, and then if you're good at you're talking about 32, 33, and sometimes some of them they end up, they make 37, $38 an hour. Some of them get to 40. So, it can range.
oh no, no, nice, lovely. It's in the UK, like there's every year different minimum wage they call it. Every year they change it, they put it up. But like for a trainee dental nurse to start with, I think it's around now it's about £12 something. But like at the time when I did mine, it was about £10 an hour. And it's always like this. There's a lot of underpayments for dental nurses in the UK in general. So Hamza, you did this to be able to fund your studies and while you were building your skills and to know the system in the US, similar to what I thought at the time. I was in the UK. I wanted to do something while I was preparing for my ORA exam, the qualification exam, but I want to earn. And I was also married at the time, and then I had a son later on. So I was working, I thought I should work in the same dental atmosphere in a dental practice, earn some money. I learned a lot in that job. I learned the communication skills. I learned how they deal with their patients, how they deal with record keeping, because each country has a different way in record keeping, softwares, taking x-rays, as you mentioned. In our country, if you remember in Syria, like we graduated under very special circumstances. The x-rays were not like always there. X-ray holders were not always like readily available to take. So it's all here made the qualification exam for maybe both of us easier, and especially the way we communicate with our patients. Because let's, for example, in the UK, the part two of the exam, it's all about communication skills. So that's what helped with that. So Hamza, you did that job and you were preparing for your NBDE.
Like
That's
what kind of qualification skills? I'm just interested. What kind of, you said communication skills. What kind of communication skills do you learn in the ORE?
in the ORE, the part two exam, it's of four parts. So one of the parts, it's called OSCEs. OSCEs is, I'm not sure if you're familiar with the term. It's like objective structured something examination, where you have to enter a room. It's like cubicles, and in the room there will be an actor, which is a patient, and then
Yeah,
and on the outside there will be a scenario written. You have to read this scenario, and then you have to go in the room and do a task. Sometimes you take a medical history, sometimes dental history, explain complications, breaking bad news. So
yeah,
this, like for example, breaking bad news for someone who's got aggressive periodontitis and they've got
yeah,
wobbly teeth and they are almost ready to lose their teeth. How you break this information and this news to these patients in the exam? These actors are very trained
yeah,
to like in the time when I did it, there was one station, it was a needle stick injury. So where they said the scenario, it's your nurse, she was trying to sheath the needle back, and then she stabbed herself with the needle, which after
yeah,
used on a patient,
yeah,
and go in the room and manage the situation. I
yeah,
went in there. I swear I still remember this. It was in 2017 though, 8 years
yeah.
ago. I went in there, I saw a lady in her 30s maybe standing up and holding her finger, and she was like upset. I told her, oh, what's going on, blah blah blah, Amy something. And she said, yo, I was trying to clean the instruments, sheath the needle, and I stabbed myself. And she started crying in tears.
Oh, really?
Wallahi, it was in tears. I was looking at her, I thought, oh my God, but like, come on, man, just chill, chill. I couldn't. And then I started just tapping on her shoulder, showing like empathy and trying to show my communication skills. And when I finished the exam, I still remember I waited outside the Royal College of Surgeons at the time where the exam venue was. And she walked out the venue. I stopped her and I told her, like, what do you do for a living, really? And she said, we're professional actors. So they work as actors in movies, series, and then they are like hired by agencies to come and do the exams. They get trained and they did it. So that's one
It's
of the
like, have you seen Friends?
yes.
Yeah, it's like, Joey gets a gig and like he goes to like one shop, one area, and he acts like a patient so he can get paid like a gig and just comes back home and eats
That's
pizza at the
that, that's maybe Joey in the
end.
in the exam. It was one of them, but then there are other two exams called medical emergencies. Also, will be actors, like no actors, like will be with examiners, and dental treatment planning. It's also about communications. So I learned a lot. Also, like nowadays with my daily life and when I work in practice, I'm still like always appreciative of what I learned from those guys, because they don't only teach me clinical, like I've seen a lot, I learned a lot from clinical skills side of view, but also the way they speak to the patients to try to offer treatments. We're in a very special profession. We're dentists, medical professions, but also we're business. You need to sell, but also you need to sell ethically without making the patients feel that you are selling them this for the money, but you're doing it for their best interest. So I learned a lot, and I'm still like, nowadays people pay to shadow someone with experience and skills, where at the time maybe me and you, we were getting paid and we're still shadowing someone. So that is
Yeah.
almost like a time to remember. I was in London at during that time between 2016 and the end of 2017. This is when I was doing the dental nursing. So yeah, until I finished my ORE exams, and then I started looking for a job as a dentist and I left them. And yeah, journey takes us from one place to another. Going back to your journey again, because I think people will talk more about myself later, for also your audience, if anyone is interested in the UK, maybe live in the US. I'm not sure about this,
Yeah,
but you finished, then you did the NBDE, which is two parts, part one and part two.
yeah,
So the
yeah.
NBDE, it's a theory exam.
Yeah, basically you have the you have two parts. They're both theory exams. There you go to a center called a Prometric Center here. There's a bunch of them here. And you go, there's like a bunch of computers and things like that, PCs. You sit in a PC quiet room and you take an exam from start to finish. It's like a whole day thing. You start at 8 and you're done by like 3, 4 p.m. with some breaks. They have, I don't remember now how many questions. So back in when I did it, back in, like when I did it in 2014, 15, things like that, they
Mhm.
had two parts. They had part one and part two. Part one is more basic science, physiology, biochem, things like that. Part two is more dentistry, more like, okay, you got perio, endo, ortho, pros, things like that. And then you used to have to pass part one, and you have to get a good TOEFL score. And then you apply. If you want to become a dentist in the States, you have to take you have to apply for a school, and you do 2 years of dental school here in the US, so you can be able to work as a dentist in the US.
So you did it in
So in
Boston
order
as
for you to apply to a school like that, you need to have the part one pass
well.
and the TOEFL with a good score. Nowadays, the part one and the part two are combined together. So it's
Mhm.
one exam, but 2 days. And it's called the INBD. It's like the kind of integrated whatever. I don't even know exactly. But something like where you have two exams in one integrated into 2 days. And you're going to have to go there and you're going to have to just pass that exam. And then once you pass the exam, you do your TOEFL score. You get a good TOEFL score. And then you submit your application. You need to be a person who graduated from a dental school from outside. So outside the States. Like if you're a person in, anywhere in the Middle East or Europe or whatever, you have to finish and graduate from dental school in your country, and you have to have the IMBDE exam pass, which is the integrated one, and you have to have the TOEFL with a good score in order for you to apply. Then you apply, you go through something called like a transcript. They transfer your transcript to make it more American kind of like transcript. So you submit some transcripts and things like that. Some recommendation letters you need from some people, preferably from people in the States here, and once you're done with all that, then you get an interview, and then you match in one of those schools, and then do these 2 years, and then you can become a dentist here in the States, and then that's when you're called a DMD, person.
Have any idea about the price, the cost of the NBDE or INBDE? You can't remember.
I don't really know. And I think it was like 7 years ago. It was like $500, $400. I think now it's a little more because it's two into one. Maybe it's $1,000 now or something like that. I don't know.
Yeah, yeah, yeah. It's now the same. Like with in the UK, for example, the ORE exam, the part one, which is the theory exam, there is two papers also done in 2 days. Paper one, or paper A, they call it, is basic science. Is physiology, biochemistry, embryology, all of these like bad science to remember, difficult ones. And then the second day is the clinical ones, which is the same. Again, price
Mhm.
wise for the part one, for the 2 days, about £575, which is
Mhm.
in dollars maybe about 900, $800. Then when you finish, so to choose, so you put like preferences for your choices for the dental schools when you finish the NBDE or the INBDE, the universities you want to study in the 2 years to get the DMD.
No, you don't put it's not like you put your preferences and then you see which school you get into. You apply to some schools. Let's say you apply to 10 schools.
Okay.
Out of those 10 schools, you get 5 interviews. So the five that didn't give you an interview, you're not gonna go there. Then you get the 5 interviews. You interview in these 5 schools, and then those interviews are not obviously they're not in the same day. So you may get an interview from school one in November, and then an interview in school two in December, and things like that. And then once you get an interview, sometime after 2 weeks, a month, 1 week, something like that, you you hear back. You either hear an acceptance, or you hear maybe a rejection, or you may not hear anything. So if you hear back with an acceptance, they usually tell you you have 2 weeks to accept this offer.
Mhm.
So if school one interviews you in September, and you do your September interview like mid-September, and then 2 weeks later they send you an offer in October 1st, and they say you have 2 weeks to submit your offer, you're stuck sometimes, because sometimes you really want to go to a school who you have an interview with in mid-October. So you're not gonna know if you're gonna get in or no. But you really want to go to that other school. So then what do? Do you accept your offer, or do you go to the school in October and you do your interview and hope that this is gonna work? So sometimes you just go through this dilemma, which is a good thing because it's not really easy to get in.
No,
So it's a good problem to have. But sometimes that's how the I'm just showing you how it works sometimes
no,
here.
no, good to know. No,
So you
from
kind
a
of get it.
person been through this, and I
Yeah.
can tell that you've been through this like dilemma. Like you want to go to this one, and this is your preference, but you had an offer from a university, and you have only 2 weeks to accept the offer. And if you
Yeah.
accept this, you can't go for the other one if you had an offer from there, which is your first.
Yeah, exactly.
But you
But
think
I
like
don't
something
like
on the
for me, this
table.
is not what happened to me. This is not what happened to me. And this what happened to me is I applied to one school only, and I got in, and that's it. Like I
MashaAllah.
didn't have so many options or anything. No, I applied to more than one. I applied to maybe five or six, but I didn't get any interviews. I didn't get anything. I knew like I was just kind of throwing these into the meta, or whatever you want to call it these days. And it's not gonna happen. So I had like my focus was on BU, or Boston University, because I was from in Boston. I did some courses. I kind of got myself in the system a little bit through working as a dental assistant, which helped me get in touch with some people at BU. So then I felt like this is gonna I felt like this is something that's great, and we have an opportunity here. So this is where my focus was at most. So I got in, and it worked out, and we did it. But usually I'm just kind of showing the people how the dynamic works sometimes, and things like that.
Have this like understanding. How do people maximize their chances to get accepted in a specific, let's say, university? Do they need to
Yeah,
do specific things in the CV? Do they need to do courses? Is it relationships? Is it their GPA? Is it
yeah.
NBDE?
Your dental school GPA from your country. So we used to think, or like, oh my God, remember when we were still in school, and I was like gonna go to, I knew I was probably gonna, escape the war in Syria and come to the States.
Mhm.
So I was always worried, like, is the score matter? Because I didn't have like the highest score ever. I didn't have like the highest ranking at IUST or anything like that. So I was like a little worried, and I was like, maybe they need like a really high score from my school or something. If you're okay and you don't fail all the time, and you have, you're an average B student, or a little bit more than that, you should be okay. That's not what they really care about, because they understand that every school is different, and some schools can be super difficult, and a B is an A in another school, and things like that. So what really matters is there's certain requirements, as we said. You graduate from your international school, you need your NBDE, and you need your TOEFL, a high TOEFL score. This is the requirement, some recommendation letters. Now, what's going to make you stand out is a high TOEFL score. Usually, a TOEFL score of over 100 is a really good score. I think it's out of 120,
Mhm.
but we'll check. But usually you need a high TOEFL score, and then you need some really good recommendation letters. And in order for you to get those recs, you need to get yourself in the system. And there's many ways of how you can get yourself in the system. There's one way, which is the way I did, is to go and work as a dental assistant, and hope that some of those people have some connections with a dental school, or they teach there, things like that. Another way is to, do a 1 year like master's degree at a school, which is, less competitive to get in. You may have to pay a little bit for that, but that's another one. And then you get some connections there. They see you're interested, they see who you are, and then you get in. So the idea is to transfer yourself from being a piece of paper, even if you are a really good piece of paper. The idea is to transition yourself from a piece of paper to a person that they can see and know that they can, have a good interaction with. Because at the end of the day, they know that what they need is not just a good talent. Talent is good and having good scores is good, and all of that is very important. And I'm not saying, I'm not against that, but they know that a huge part of it is being, a person who's ethical, being a person who they can deal with for the next 2 years, being a person that you can have a good relationship with. And no matter, how many papers you write, no matter how many things you try to do on that application, nobody's gonna be able to see who you are. So that's where you have to put yourself out there to the system so they can see who you are and get that feeling that they can accept you and they're confident that they're getting a good person.
Yeah, they need to see that you're hard worker, as you said, ethical. They need to see you in person. And this is
Yeah.
one thing also, like I realized when I applied for my specialty training. Now I'm doing it. During this semester, I saw the prof, the chair of our program. He came into the lab and there was like some people with it. I looked and I thought, who are they? And they turned out to be students applying for next year, but they took
Mm.
that extra step where they reached out to the university and to him and they introduced themselves, even though
Yeah.
the work maybe is not the best, but they
Yeah.
came to show him that we are really interested in what we're going to do and a new program. And at the time, I think they get the acceptance before even they were invited to have the interview.
Yeah.
I feel like that's a clever move.
Yeah, man. I remember one time when I was a dental assistant, I was halfway through my journey as a dental assistant, 6 months into it. I was so desperate. I had no clue if I was gonna get in or no. I didn't know what was gonna happen. And at a moment of desperation, I went to like the BU kind of website and started like looking at people. And then I found a person, her name is Catherine,
Mhm.
and she was like responsible to related to like some program related to the international program school and things like that. I was like, you know what, let me just throw it out there, and I emailed her. I had no clue who she is. I had no idea anything about her, and I just emailed her, hey, this is my name, I'm Hamza, I'm working as an assistant, very interested, would love to meet with you, and I have a few questions with regards to the program, and I would love to just sit down and meet with you. She answered, and she agreed, and I went to and I met with her, and I prepared questions, and I wore a suit and tie. I was a 23-year-old with a suit and tie, and
So
I prepared
Mike,
some
Mike
questions.
from Suits.
Yeah. Yeah, and I shaved. I had no beard. I shaved all my beard, man. Things like that. And I went and I asked her some questions to show her that I'm interested. Oh, and because I was interested and to learn more about the program. So then I went and I asked her the questions, and through the questions we had a really good conversation. I did some follow-up questions. She asked me about myself. So it seemed like it was an interview
Nice,
from start to finish. And
nice.
that was before me applying and before anything. And when
She
we
knows
were
you
done,
already.
yeah, and when we finished, I told her, thank you so much. I really appreciate the opportunity. It was so much fun meeting you. And I would definitely, I'm gonna apply, and I'm very interested, and I live here and things like that. And she said, once you apply, email me your application code, which is like a little code
Mhm.
that you usually get when you apply, your number, so I can flag you.
Give me a nudge.
And indeed, when I applied, I gave her the code, and she flagged me. When I applied, I got an interview and it worked out and everything went well. So this is what I'm saying, these little things that are related to getting in and meeting the people and getting this into the system is, very important.
You need to show initiatives. They need to see that you're someone
Yeah.
who's like interested to learn and go above and beyond to learn, and you're not afraid to go out and ask for things. And exactly this is what they look for. And these people generally, like here, US, anywhere, normally in Europe, when they see an email from someone, they look at it that this person has took the time, wrote this email. It's very disrespectful not to reply back. We think and we thought like they won't even bother, they will read it and just throw it away. And this is, to be honest, what I always try. If anyone is reaching out to me and texting me or emailing me, I was in their shoes before. I always try to reply back and have a look at what they've got. Even the question, even if it's silly, I'll try to help even these people. So they try and they look at it, and you never know what's going to happen. If you don't ask, you won't get. This is like a common say in everywhere, possibly in England. They always say, if you don't ask, you won't get. So we have to do this. But no, amazing to know all of these tricks. Surely, I think it will help a lot of people about when they are looking to apply. Now, for these 2 years, you did some undergrad studies and some exams and the tuition fees for these years, if we can go through them with you.
Yeah, the tuitions, it's every school is different. So some schools have more tuition than others. But on average, you're talking about somewhere around 70 to, 60 to $80,000 a year. This
Mhm.
is just the tuition of the school. And that was 8 years ago. I don't know how much it is now, but I'm sure it's up higher. And then you need to add around, depends on also where you live. Here in Boston, it's more expensive than another place, but you need around, $30,000 to $50,000 a year to live. So that's usually how much you need. So you need a year, you need somewhere around like $120,000 or something like that in order for you to kind of be able to function. I didn't have any of that money. So the idea, it's not like you need to have that much cash in order for you to do this. Like you
Hard,
can
unless you
apply
work
for
with the mafia.
you need to apply. You can apply for a loan. Everybody does that. I did that. When I came here, I applied for a loan, and then I got the loan, and the loan pays the school, and it's very easy process. The loan pays the school, and then the loan gives you some money to live per year, and they will give it to you. I think, yeah, they give it to you 1 year. They just give you that amount, and then you live. You pay off that loan while you're in school. You have the option of not paying anything to the loan. So it's not like you have to pay the loan. Like it's not like you have to pay, let's say the loan, you have to pay $1,000. It's not like you have to pay $1,000 a month while you're at school. You can pay $0 a month while you're at school. And then once you're done with school, then the loan will start asking you for the money. So, they make it very easy. They do understand that this is the way, this is the path. So they make it easy for you to be able to do it. So yeah, you get that loan, and then you go through school, and the school pays, the loan pays for the school, and then you basically start to repay that loan. You can do it either over 15 years, you pay a little bit more extra money per month, but you're done early, or you do it over 30 years, and then you pay a little bit less per month, but you pay it over 30 years. And usually that means that you're paying a little bit more money.
Interesting. And then when you finish, you graduate as a qualified dentist in the US, where you
Yep.
can work as a general dentist
Mhm.
anywhere in any state.
Yes, you can work as a general dentist in any state.
Mhm.
You're just like any other general dentist in the US who was born and raised in the US.
And qualified from a US university.
Yes, exactly.
And we said something before we started recording. You said like general dentists in the US can do anything they like in any
Yeah.
specialty without being specialists. So,
Yes. Yeah. So if you're a general dentist, let's say you're a general dentist and you really had to place implants, and you're really, really proficient at it. You're not going to learn how to place implants in this 2 year school that you go to become a general dentist. You may place an implant or two. Maybe nowadays it's like four, throughout your career, throughout your schooling. But you're definitely not going to be proficient at placement of dental implants at all. So your degree as a DMD will allow you to place implants if you really know how to place them. There's no restrictions to you being able to do anything you want as a general dentist. So you can do, pros, you can do crowns, bridges, you can do implants, you can do extractions, you can do endo, you can do veneers, you can do whatever you want.
as long as they are competent in what they are doing.
Exactly. Yeah. You wanna know what you do. That they just basically, the board trusts you that you're gonna be making the right decision for yourself, and that you know what you're doing when you do it. So if you don't know how to extract teeth, then don't extract teeth if you don't know how to do it, or take some courses and learn and get better at it through courses. But they trust you in doing them, that you're gonna make the best decision for yourself.
So in the US, who's the regulatory body, like the council? What is it called?
What do
The
you mean
council,
regulatory?
the general council. What is it called? The
I
dental.
think there's the American Dental Association.
Okay.
Yeah,
ADA.
ADA, yeah.
And what is the annual retention fee? Like, how much do you pay to keep your license valid per year. Do you renew it every year?
Yeah, you renew your license every year. Maybe, I don't know. I usually pay maybe like, I think you renew it every 2 years. Usually pay like 700 or $800 every time.
Not
Yeah.
much, not much.
Yeah.
And
And then
it,
you have to do some CE courses.
Mhm.
So once you're done from
Mhm.
general dentistry and you become a DMD, the first couple of years, like I don't really know exactly the number and things like that, so please don't take me on that. But the first maybe 2 or 5 years or something like that, you don't need to take any CE courses because you're a fresh grad, you already have all the up-to-date knowledge. But then you're required to take certain number of continuing education courses or CE courses. So some CE courses, they are one CE course, some of them are three CE course, and then you have to have certain number every year to retain your license.
Similar to here. Here, like we've got something called CPD. Is
Yeah.
100 hours they call it per 5 year cycle, and every year you need to show at least 10 hours where you've done some CPR course as a refresher. So I always want to see this.
Yeah.
And also tuition, like not tuition, retention fee they call it, or ARF or something. Per year here in the UK is £680. So it's similar. But also you do have indemnity. So you pay indemnity.
What's indemnity?
Indemnity like insurance if you've got any complaint. So there is
Oh, malpractice. We call it malpractice insurance.
malpractice. Exactly, yeah.
Yeah. Yeah.
So you do
Yeah.
pay. So you
Usually,
have
usually, yeah, at the beginning, you don't pay a lot of malpractice, because it's just the way it is. And then when you first finish, your malpractice is low, and then the older you get, the more malpractice you pay.
yeah, it's the same here, but you pay it separately. Let's say in Canada, we've got Basil. Basil said they pay their council, and as they pay like the dental association there, they pay part of it is the malpractice, part of their retention fee. Here,
Oh,
other like separate providers like indemnity, we call it here, not malpractice. So we
yeah.
pay them and you find the better quote and you pay like you're having insurance for your car. You finished the course or like the 2 years and then you worked as a dentist. You did a year
Yeah.
or 2 years as a
Yeah,
general.
yeah, I worked as a dentist for a year. I did, pretty much the normal bread and butter general dentistry. I did composite fillings, I did crowns, bridges, restored a couple of implants, things like that. Yeah, it was really nice. I learned a ton and I, built so many relationships and I actually worked in the same practice when I was an assistant.
Nice. Okay. That's good.
Yeah, I was when I finished, I came back to the practice that I used to assist at, and I worked as a dentist there. So I became a dentist there. So I already knew everyone. We already had like a great relationship with each other. We already love each other a lot. So I came back and was like, okay, what's up, guys? Let's go back,
That's good. You were able to
Yeah,
offer this.
and so it was a very smooth transition. It was so much fun, but I knew I wanted to do something more, and I knew that this is not it for me. I knew that I wanted to do something more, and because of my influenced by Dr. Daher, who is the oral surgeon that I used to assist. So I was applying at the same time as I was working as a dentist to oral surgery residency
Mhm.
and I applied to five schools across the states. And I got two interviews. One at BU, where I was a dental student, and one at Tufts, which is across the street. Usually, it's like a mile away in like a Chinatown area here in Boston. And this one is a match. So this one is once you interview, you rank your schools from the
Okay.
top to bottom and
Mhm.
then the schools rank the candidates from top to bottom. And then there's a software that matches everybody together. So I ranked my two schools and two and only schools that I got interviews at. And I ended up going actually to Tufts, which is the school that I wasn't a dental student as. It was a different school that I went to. And then Tufts, it was a great experience going through all the residency. Hard. It's difficult with a lot of call, a lot of stress. It really sucks the life out of you. But it just makes you a better person or a tougher person at the end of it, which is really nice. And then I graduated 2 years ago. from residency, and I've been in private practice now for 2 years.
During these 4 years, I remember you said that you don't pay tuition fees, they pay you for oral
Yeah,
surgery. So
yeah.
for specialities, we know like there's pros, perio, other things. Just
Mm.
like briefly, which ones do they pay tuition fees and which they don't?
Basically, from the specialties of pros, endo, pedo, and perio, there are limited schools where they pay you, but these schools are extremely limited. I think there's like 3 or 4 schools in the whole country from each specialty that do that. Most of the schools for these specialties, they require tuition from you, and that tuition is usually similar to a 1 year tuition at a dental school. So it's a similar fee. It's not much higher, I think. Except oral surgery. Oral surgery, they pay you money rather than you pay them. And it's enough money to live a decent life in the US. And that's because you do a lot of hospital work and you do take a lot of call. So you're literally working all the time. There's no such thing as a break at any point.
It is very competitive to get into oral
Yes,
surgery.
yes, very competitive.
It's not easy.
Yeah.
And on average, like per year, if like I know like numbers can be found, but like as
Yeah.
of on the top of your head, like how much roughly as a salary they are expecting per year if they decide to go and take that path.
Yeah, as a salary, I mean, your first year you get maybe 50,000 a year, something like that, becomes like 56 or 55. And then by the time your fourth year, you're making like 60, 65.
Very,
So it
very
gets
close.
higher every year. Yeah, yeah, yeah.
This system in the UK, like very close to the US, to be fair.
Yeah,
There's
yeah,
a lot
yeah,
of similarities, but like the specialty here, it's not 4 years, it's 3 years. And oral
yeah,
surgery, like you can either pay and just study in the university and you have then some shifts in the hospital, or you can go and do, they call it national recruitment. So you work under the NHS, which is like the insurance for by the government for the people. So you get paid for this and you work in a hospital and not necessarily to study in academic school or a university to learn or do any research. So your
yeah,
main learning is like hospital based and
mm,
you'll be doing like 9 to 5 jobs. You may have on calls, you may have weekends to
yeah,
work on. And you've got salary similar, like 50,000 maybe pounds a year before tax. And at the
yeah,
end of the 3 years, they can then apply for specialty registration through the General Dental Council, which is like the ADA in the US, and they become oral surgeons. Now, as competencies, when you do oral surgery, does it cover oral max fax or just the minor oral surgery, if we call it in Syria?
No, it's every oral surgery program here is oral and maxillofacial surgery. There's two kinds of residencies that you can do in the US for oral surgery. There is a 4 year route and a
Mm,
6 year route. A
okay.
4 year route where you do 4 years of oral surgery and you graduate as an oral surgeon and you retain your DMD degree, you're a dentist. The 6 year route, which is you do the same 4 years of oral surgery that the 4 year route does. In addition, you do 2 extra years of med school and you graduate as a doctor, like as a physician, an MD.
And you do those 2 years after the 4 years.
No, you do it. Every program is different, but usually it's done the first 2 years, 2 to 3 years. So you basically become an MD, and then you do your 4 years. Sometimes you do your first year of the 4 years in residency, and then you do your MD for 2 years, and then you do the rest of the 3 years after. So every program is different, but usually it's done at the beginning.
In
Yeah,
the UK, to be able to oral surgery is the minimum 3 years, as you said. But if
yeah,
someone wants to do max fax, they have
mm,
to go back and study meds for 3 or 4 years, depending on the university they're applying to, and they have to pay per year at least 10K. That's like
mhm,
normal for home fees, of course. If they are overseas, you're talking about maybe 50K a year and
mhm,
then they have to apply for oral max fax posts. And there's a
mm.
lot. And oral maxillofacial surgery here in the UK as a journey, it could take them about 15 years. It's just crazy, and the money in there,
Wow.
it's not worth it. So
Yeah,
being an oral surgeon is safer and nicer, and you're not like dealing with people's life a lot. Like,
yeah,
okay, you've got like still having the best of both, are dealing with blood and taking teeth out and you doing the surgery
yeah,
you like, but also you're not having big weight on your back
yeah,
that if this person on the table die,
yeah,
then like you feel like we always like feel there's something. Now you're working as a specialist oral surgeon in a private practice, placing implants, taking wisdom teeth out, doing all sort of things, and you do sedation.
Yeah, we do offer sedation, which is one thing that oral surgeons are able to do or licensed to do
Mhm.
compared to the other specialties, or a general dentist. So if you just graduate as a general dentist or from other specialties, you don't have sedation license. The only specialty that allows you to have sedation license is an oral surgery specialty.
Mhm.
But you can, is as a general dentist or as anybody who's not an oral surgeon, you can take some courses and learn the sedation, and then you can implement that in your practice. So that it's oral surgery is not the only way to have the sedation license. There's other ways, but when you graduate as an oral surgeon, you automatically have that sedation license with you.
Is with you. Okay, let's get to the nitty-gritty. I think the question everyone been waiting for.
Yeah,
So now we have to compare salaries between UK and the US. Let's
yeah,
talk general dentists. On
yeah.
average, what is the salary? I know like the practice, the area, the city, everything plays role and what type of treatments you deliver. But like on average, according to statistics, for example, like what is the average?
So when you're talking the states, it's very different because every area in the states is different than another. It's a huge country,
Mhm.
so some salaries that you may take in Boston are different than the salaries that another person would take in a middle of nowhere kind of Midwestern country or city or whatever or state or whatever the case may be. So in these situations, the salary differs a lot, but the cost of living is also different. So,
Mhm.
like if you live in Boston, the cost of living is high versus if you live in another place where the cost of living is low. Usually the salary is, there's no such thing as like a base salary that you earn. That's usually how that usually comes in when within the first 6 months, the first year, they usually can give you what we call a guaranteed salary. For example, they give you a guaranteed salary of nowadays I think it's around like 750 or $700 a day. So if you do the math, if you work 250 days a year, that's what $750 times 250. That's like $187,000 a year.
That's a base salary.
That's a guaranteed usually base salary. So you talk that's like here in Boston. So like somewhere around 150, 160, 170 a year is usually what you're looking at, maybe 180, something like that. But that's just for the first 6 months or a year. And then you basically make money out of a percentage to negotiate a deal with your doctor, with the dentist that you're working for, of, I'm going to give you 25%, 28%, 30%, 35%, whatever the case may be, of the treatment that I do. So if you do a treatment of, $2,000, for example, in one day,
Mhm.
then you take 30% of it. And that means that you get that amount of money per day, which ends up being around, for example, 700 or 800, or maybe more. Like you may get to a point where you're making $2,000 or $3,000 a day.
Is that
So
on top of the basic salary or
no,
no?
no, no. Basic salary then goes away. They say like you get a basic salary for the first 6 months, and then you're on your own.
So then
So if you
it'll be a
don't work,
percentage.
yeah. So if you don't work, then you're just gonna make zero money.
You're
Uh,
self-employed.
exactly. And if you work, then you're gonna make that much money. And you work, and this is basically how it works.
So it ranges, as you said, it depends on the area, but like the bare minimum when they start, it like 150K as a US dollars per year,
Yeah,
and
yeah,
then it goes up depending on the deal they've got, the
yeah,
percentage, and the type of treatments they deliver, and where they
yeah,
work. Because in some places where they need dentists, let's say, as you said, in the middle of nowhere, they may
yeah.
negotiate a better deal. Where if they
Mm,
live, I'm not sure if Alaska as like a place is a
yeah.
middle of nowhere.
Maybe,
It's cool.
yeah.
Yeah.
Let's call them areas where there's a lots of demand. Anywhere, in any area where there's lots of demand, you can negotiate a better salary because they need you. Yeah.
And because I heard numbers like 500, like half a 1,700,000 for a general dentist in the US, which
Yeah.
sometimes people ask me like, what do you think? I always tell them like, I think US makes more money, but like
Hmm.
it all depends on what you want, UK or the US.
Yeah.
There's pros and cons in each. So for
Yeah.
the UK, for example, so the general dentist, they start on maybe the first year, we start straight away on percentage. So in the UK, unless you work in hospitals, you then get salary. In the UK, you get a percentage. Normally, our percentage is 45% or 50%, and most of the cases 50% of the treatments you deliver. And then there is something called NHS, which is like the stupid NHS system, National Health Service from the government for like people who lives here. If people do in NHS, again, the money is less, but like on average for first year, maybe about 50k pounds, which is about 75,000 dollars a year for the first year. Then the second year it jumps to 70, 80. Nowadays, general dentists, maybe with some good experience delivering what they call clear aligners, composite bonding, some sort of cosmetic treatments, can go to 150k a year. But I know people who are general dentists and they can net profit as to 50k thousand pounds a year. That's before tax. And taxation is a bit of a thing to go through. We don't want to go through it. It's a headache. So that's like a rough idea and compare between the US and the UK. Now, as a specialist, do money get better or stays the same?
No, it gets better.
So percentage changes or the type of treatments, the prices changes.
Both. It depends on what you do and where you work and things like that. But you may work in a place where you get more percent. Your treatment is also, more. You're doing more person. Even I think here there is, just if you just talk about insurances, for example, as a general dentist, if you do like a code for extraction, your insurance will pay you, for example, $100 for it. If you're an oral surgeon and use the same code in the same area, then your insurance will pay you $170 for it.
Okay. Even the
So
insurance pays you more.
yes, yes. So even because you're a specialist, you can charge more to the insurance, even not just to the patient. So the treatment is, not all the treatment are more expensive. Like if you do a crown, that treatment is more expensive than doing extraction.
I always,
Um,
I always, I always use that example. If you want to go out with Beyonce, you have to pay more.
yeah, yeah, yeah,
So
maybe.
specialist is
Yeah,
Beyonce. I tell my patients sometimes like why the prices are too high. I can
yeah,
always tell them like you can go down the street and buy like things from Primark or like H&M, but then you come in to buy things from Gucci or whatever Louis Vuitton, and then they look okay. That's very confident, but like to be honest, I know what I'm delivering. So it's the same case. And I do 100% agree. Like yourself, maybe you take a wisdom tooth out in what, a minute, 2 minutes, and then general dentists may like damage everything, rip the soft tissues, damage the bone, can end up with issues and nerve damage, let's say. And some patients like, oh, it's only 1 minute job and you charge me this. It's for the skill and the time you invested in yourself, not for the time on the chair. Have you had the tooth out? Are you comfortable? Have you had any complications? No, happy days. So everyone happy. This is what they are paying for. Yeah, so no, interesting, amazing career, Hamza. I'm so happy to be with you here. I want before we end, it's been, I think, I'm not sure, we've been talking maybe for about hour and something so far.
yeah, an hour and 6 minutes.
Yeah, so I want last thing, an advice from you to new dentists graduating on what they do if they are considering the US, and do you think it's still worthwhile coming to the US and pursue their career, or what do you have?
Yeah, I think
Tricky one.
so. If you're a person who's looking for an opportunity here in the US and believes that you like to be here and want to, work hard for it, if you work hard, you will get it, and it's going to be very worth it. So, that's what I think is going to happen. I think US is a place where it's hard to get, but once you get, it's very worth it because there's so many opportunities here.
Rewards the hard worker. Like your journey
Yeah,
will pays off at the end. And in Syria, in Damascus, we love says and we call it amtal. There's a say, the hungrier
yeah,
you are, the tastier the food will be. So for long journey
Yeah,
and the more effort you put, you can see like every blood of like every drop of blood and tears, and you look
yeah,
back at your journey and you're always proud of yourself because you've built a legacy to raise your country's name, your name, your kids when they grow, they look at you and they always appreciate it. Of course, we always thank our parents for everything and opportunity they gave, but always it's our duty to continue on and learn, never stop learning. I always tell them now in the Middle East or any place, anyone listening to us, dentistry is now more difficult due to the fact that there is a lot of people studying dentistry and graduating, at least from Syria, Jordan, and Egypt. I heard that in Egypt now there are 80 dental schools graduating per year. I'm not sure how many. I heard that they've got over, I don't know, 80,000 dentists in Egypt, and opportunities then there is near to nothing. So they have to go somewhere and they go to Dubai, UAE, Saudi. Their general dentists, they are getting paid peanuts. So they have to really think big and they have to think for the future on the long run. And yourself, I believe you just like me. I always advise them to plan your life ahead for at least 5 years. So have a plan for 5 years ahead. And Hamza had this, I think, from since he was in the uni, maybe he planned his life 10 years ahead. Myself, I was looking like 5 years ahead. Hamza, I know, like he was planning, and I remember he said, I want to be an oral surgeon and I want to go to the US. Do you remember this?
I do. I do remember it. I do remember it.
So
But the whole idea is at that point in time, I didn't know it was gonna happen. You're not gonna know, like if you're now a dentist or someone who is in dental school and thinking like about coming and making the move, you're not gonna know if you're gonna make it or no. And that's fine because I didn't and you didn't and nobody did. This is the beauty aspect of it is you're going to roll this dice and try your best to do it, and you're going to have to work hard to achieve that dream, and then it doesn't matter if you end up achieving it or no. It's great if you end up and you achieve it and you get to that dream, that's perfect, but the skills that you're going to learn along the way in order for you to achieve that dream is what really matters, not the actual dream itself.
you always
And
find something.
yes, and if you have this mentality, and if you discipline yourself to that kind of mentality of I'm doing this not so much just for the results will come if I do the hard work, but I'm doing this because I want to learn more skills. Like now I'm starting to do social media, I'm starting to do these things. I had no idea about how to do anything related to social media. I had to learn all that, and I learned editing, and I learned photography, and I learned so many different aspects and analytics and data and things like that. And no, it doesn't matter, how many followers I'll end up getting or whatever the case may be. I'm doing this because I'm having fun learning these skills, the editing, the photography, the different kind of skills, creative skills and data and analytics. When you learn these things, this is what really matters, not so much the end result of what's going to happen with this social media thing or whatever the case may be. So I'm always a believer of that. And that's why I say, just make the jump, do the move, and be willing to work hard for it. And you're going to have good days, you're going to have bad days. But as long as you continue to focus on that path, you're going to end up getting to that path.
I always say, enjoy the journey.
Exactly.
I had exams a few weeks ago for my specialty, and it was tough ones, and everyone was panicking and worried about it. And I always told them, look, everyone will pass, and time will pass. Like, it's not about getting to the target and to your goal. You're gonna get there. One day you're gonna get there if you're disciplined and you know what you are doing, and you just stubborn. You wanna get there. Enjoy the journey. You're gonna love it. I still remember and regret that I didn't enjoy my years at uni more. Our uni days, even though there was like war and the country was not at its best, but every single day, the friends, the time we spent, the time when we used to go out, study, the exams, patience, the fun. So always enjoy every moment and don't think too much about what's gonna come later. Of course, have a plan ahead for 5 years, maybe. This is my opinion. So you don't walk blindly in like
Yeah.
your life, at least.
To be honest with you, I had exactly the same thoughts at one point. I maybe like last month or something. I was thinking exactly the same thing of, man, I really feel like I regret not really enjoying the dental school and those days in dental schools and things like that. Looking back at it, I feel like I enjoyed it and it was fun and I had lots of good time. It was really difficult with the war and everything, but now I have positive, kind of memories on it, not negative memories. But I still feel like I could have just enjoyed it more. The funny part of it is when you start to think about it from now and 15 years later, because I can tell you for sure that 15 years later, you're going to go back to you being 34 years old and thinking, man, I wish if, I enjoyed the 34 years much more than what I actually enjoyed it and had fun with it. And then the interesting starts to happen, which is now thinking about it from now and 15 years later. And then you go like, no, man, I gotta enjoy this more.
Yes.
And yeah, and I'm enjoying it much more just because now I have this thought of, I believe in that, older Hamza that's, 15 years older than me, telling me enjoy it more and continue to work so hard and just, kind of do the things that your gut feeling is telling you to do. And it's never been more fun, man.
I think we coming to an end if we're happy with this. Thank you, Hamza, for all the time we spent together. It's been really interesting and good to catch up with you again. For anyone who's interested in the US, the journeys, the life, becoming specialist, oral surgeon, anything related to these things, Hamza has his own platforms on Instagram. He's got a surgery page and his work is top notch. I've seen like implant placements where like people who do implant placements without surgical guides, like just in the air, these people are very skilled. So Hamza is one of them. He does both. He knows like the digital part and the freehands one. He does all the surgical bits. So if you want to learn, possibly Hamza in the future will have his own courses. He may come down to the Middle East and be one of the tutors and deliver all the knowledge he learned in the TAF and have it in the Middle East. Also, he's got his professional page about advices, career advices, and the US in general with dentistry. We'll drop this below in the description. We'll have it on Instagram as well. I'll share his details so you can reach out to him. At the end, if you've got any questions, you want me to talk about anything, leave a comment down below on YouTube or on my Facebook or Instagram pages. And don't forget to subscribe and like and share this video with anyone who's interested in both journeys. They want to see comparison between the US and the UK. I was fortunate enough to know Hamza from before, and now seeing him doing all of this, I thought I should have him here to just talk about his journey, which is really interesting. Thank you, Hamza. And I'm not sure if we've got any
Thank you,
last
Anas,
words for
man.
everyone.
It was really nice talking to you. It was so much fun being together at school with all the guys and everyone. And it's really great what you're doing also with your YouTube page and with everything that you got going on. I know it's a lot, but you're also, a tough cookie and you really work so hard too. So I
Yeah, man.
appreciate what you're doing. And what matters most is really just trying to, help as much as you can and, contribute as much as you can.
Of course.
And, that's the most important thing. And I feel like, we're really trying our best to help patients and help people and, help everyone to kind of just get to their dreams and get to their, hopes. And we're here to facilitate all that for all of them.
Yeah, no, share our journeys. So hopefully one day, we never know, we're gonna meet again in Damascus.
Maybe.
Go back and maybe have some football games and
I'll play some cards. I'll do something.
Inshallah. Okay. Stay tuned, everyone, for new podcasts. Next one possibly will be with a very interesting person in the UK. We're going to talk about Royal College of Surgeons, the exams, and ethics in the UK. We'll speak to you later and take care.